Welcome to our last section in our series on nutrition during pregnancy and infancy. This section is going to be covering cravings, weight gain, and research. And it's going to be a little bit jumbled because I'm going to go back to discussing some things to be doing during pregnancy and how it impacts the infant and future child. And then I'm going to be going forward a little bit to infants and some helpful tips on nutrition as they progress through their year. What I am going to start with is cravings. And I think everybody knows about the craving for pickles and ice cream, or just strange combinations that pregnant women will crave, these foods that they will crave. And what's important to know about these cravings is that they are not a representative of a physiological need. And what I mean by that is that if a result of hormone sensations, so the taste, different tastes and different smells will appear differently to a pregnant woman compared to a non-pregnant woman, and this is due to the hormonal fluctuations, not a physiologic need for those nutrients. Now, I want to talk a little bit about weight gain during pregnancy. So again, I'm going back a little bit, but this is going to lead into some research I'm talking about, and that's why I'm presenting it here. But a healthy weight gain for a healthy weight individual is about 25 to 35 pounds. The women who are underweight going into pregnancy are going to need to gain more. The women who are overweight going into a pregnancy will need to gain less. Now, getting an adequate amount of nutrition and gaining an adequate amount of weight, taking enough calories, is really essential for the health and development of the baby. It also decreases the risk of a surgical birth. But it's only about 300 calories per day, and this actually decreases towards the third trimester. And if you think about it, if you're taking in normally on average 2,000 calories a day, 300 calories a day is not that much extra. So a lot of women will assume that they're eating for two. And it's not two adults. They might be eating for two, but not two adults, meaning if you started with 2,000 calories a day, you're going to be eating 4,000. That is not the case. And this is really important because many women gain too much weight during pregnancy, and that does put them at risk for health problems, along with setting up the baby for potential health problems in the future. Now, this is where I'm going to lead into some of the research that's been done. And this was recent in the European Journal of Obstetrics, Gynecology, and Reproductive Biology. And what they found is they looked at women who had higher blood glucose levels, so that's higher blood sugar levels. Now remember, we talked about, when we covered carbohydrates, what leads to increases in blood glucose, and that's typically refined carbohydrates. Notice the image of the bread I have behind the screen here. Remember the white breads, the white bagels, white rice, crackers, cereals. These are going to substantially increase blood sugar. Now what they found is that the women who had higher blood sugar levels, regardless of being diagnosed with gestational diabetes, ended up with larger babies. Now these larger babies were shown to have higher insulin levels and higher blood sugar. So that's right after they're born, in their infancy. So remember, we talked about when you eat a very refined carbohydrate, so this is a processed food high in carbohydrates, and that increases blood glucose. So the blood glucose goes up. What happens? The pancreas releases insulin in response to that blood glucose to try and pull it out of the bloodstream and bring it back, the blood glucose back to a normal level. Now, if this happens too much, initially you're going to have these sugar highs and sugar lows, right? But then also, eventually these people end up with insulin resistance. So the cells stop recognizing that insulin and then go on to develop diabetes. Well, now, look at these infants. They're starting life with higher insulin and higher blood sugar levels. They're starting out with almost this predisposition to developing diabetes. And although they didn't discover that in this study, they did find that these larger babies, with the increased blood sugars for the mothers, had a higher risk of childhood obesity. Now, we can take from that, we can extrapolate it, although it hasn't been proven, extrapolate this to say that when children are obese during childhood, they're more likely to be obese as adults. It's harder to lose that weight as an adult. If you're obese as an adult, you have a higher risk of diabetes, higher risk of heart disease. You're basically setting your child up for a higher risk of these chronic diseases, and then also happening earlier in life. Now, before we get to our next research study, I just want to talk a little bit about food addiction. We didn't really cover this too much this semester. It's a little bit controversial. What they found is that foods high in sugar and fat will increase our natural opioids in our body, and that stimulates dopamine in our whole reward system. Now, think about heroin. Heroin's an opioid. Heroin, someone who's a heroin addict has to take in more and more heroin over time to get that same high. So they take in heroin, it basically stimulates the reward system, and then there's this drive to get more heroin. So this is the pattern of addiction. And then you need more and more of that heroin over time in order to get that same high. And it's the same with food, which is actually kind of scary. It's through the same exact system. The same exact system as a drug addict. But these foods that are really high in sugar and fat, so what we think about are processed junk foods, they stimulate that reward system, that dopamine, and then the individuals who are addicted to these foods have a greater drive to consume these foods, and they have to consume more and more to get that same feeling, that same satisfying feeling that they had in the past. And this leads us to the next study, which was done in rats, so this was not done in humans. But what they found is when they fed the mother rats a maternal junk food diet, so it was basically a rat kibble with a lot of fat and sugar, that the little rat pups, of the rat babies, ended up with addictive behaviors. So they had a food addiction. And this was down the road when they came out and then as they aged. So when they looked at those rats who had the maternal junk food diet, once they were weaned, once they no longer received the milk from their mothers, they had a preference for the kibble, the rat kibble that was really high in fat and sugar. As compared to the rat pups that did not have the maternal junk food diet, they did not have a preference for the sugar and fat kibble. So essentially with these two studies, which are, both of them are fairly recent, is that it's extremely important for the mother to eat healthy during pregnancy, because the types of food that she's putting into her body doesn't just supply the nutrients that the growing baby, developing baby needs, but she's setting her baby up for preferences in food choices that is going to impact both their weight gain, obesity, childhood obesity, development of chronic diseases such as diabetes and heart disease later in life. So very important. Now we're going to go to, in infancy, the nursing bottle syndrome is actually a severe syndrome of severe tooth decay where essentially all the teeth can become rotted. And this is in infancy, and this is from sucking on a bottle for too long. It's more common with a bottle that's filled with juice, but it also can happen with milk if a baby is sucking on this bottle for too long. And you can't blame mothers. I mean, the baby's crying, you give them food, basically your milk or juice in a bottle, and they're quiet. But doing this for too long, for extended periods, just means that the teeth are just coated in sugar, and that's going to cause a severe tooth decay. So infants should not be fed juice, should not be fed juice in a bottle, should not have prolonged sucking on that bottle. Absolutely no soda. And even prolonged sucking on a bottle with milk can be detrimental, so making sure that it's in shortened periods. And I'm going to finish up this lecture series just by talking about a few things that I've mentioned, but remember that breastfeeding should be, or formula feeding if necessary, but that should be about for 6 months. Now, some mothers will continue to breastfeed for 2 years. That's fantastic. But usually 6 months is when incorporating solid food, 4 to 6 months, and that's when children develop the swallowing reflex. They have enough coordination to actually chew food, so solid food really shouldn't be introduced before that period. But mixing it with some, weaning off a little bit, so there's some breast milk and some solid food is a very good practice, somewhere around 6 months going into a year. Now, cow's milk is not a good substitute for breast milk. Okay, so at 6 months, do not feed the infant cow's milk. It can cause intestinal bleeding in some infants. It also, with its high calcium and low vitamin C, it actually ends up potentially inhibiting the iron status of the infant. Remember, we talked about it has a great iron store, the infant, up until about 4 to 6 months, and then that pretty much is going to slowly diminish. And that's when iron-fortified foods are or iron-rich foods should be consumed. If you add milk on top of that with calcium, that inhibits iron absorption. Does not have vitamin C, which enhances iron absorption. You're going to really impact the iron status of the infant. So no milk until about a year of age, cow's milk that is. And lastly, when introducing solid foods, it's always best to have whole foods. And if you can, women can prepare the food, say in a blender, and make sure it's a soft food from a whole food source, that would be the best. But can't, and buying prepared food is okay, and introducing that along with breastfeeding. Absolutely have to check the ingredients on the baby food. Don't assume every single brand is going to be healthy for the infant. Some of these foods have a lot of sugar, and you're going to be setting up the baby for these, a desire for sugary foods later in life. You need to make sure you recognize all the ingredients, that there are no food additives in there, and there's not added sugar. Well, this is the end of our section, our whole series on nutrition during pregnancy and infancy.